In a shocking incident, Kannada television actress Chethana Raj passed away at the age of 21. The actor died hours after undergoing a plastic surgery. Chethana's parents have lodged a complaint alleging medical negligence. The actor had also complained of uneasiness post her surgery, after which she was rushed to hospital. But she was declared brought dead. Chethana's parents have lodged a police complaint and further investigation is underway. All right, so this is the latest, the story that we have been covering on Mirror Now. The latest is that the hospital where this surgery was conducted has been temporarily shut down. We're talking about 21-year-old TV actor Chethana Raj, who passed away after a liposuction procedure, and following which the family has put the blame on the hospital, where basically liposuction is a fat removal surgery, and this actor experienced some uneasiness after the surgery, and when she was rushed to the hospital, she was brought dead. And I'm joined by Dr. Mohan Thomas, who's a plastic surgeon, Breach Candy Hospital. Doctor, thank you for making time and speaking to Mirror Now. It's a very, grim and concerning piece of news that has come from Bengaluru, where a 21-year-old actor died hours after she was operated upon. This was a liposuction surgery. For the benefit of our viewers, could you help us understand the risks that such surgeries involve? We believe that this was a fat removal surgery, and though the probe is still on, but it's believed, because the family believes, that it could be linked to the surgery that she underwent.
Well, first of all, I mean, I think it's very tragic that a young lady's life has been snuffed out, and the parents are left with to deal with the loss. Now, one must keep in mind that the liposuction, for the matter of any other surgery, is a surgical procedure that should not be taken lightly. There are many factors involved in this whole business, starting with, just because somebody has a degree doesn't mean that he has the proficiency to do something, number one. Number two, there are some basic tests that need to get done before you go in and for a procedure like this. Number three, we are Indians, and in Indian cultures, even if somebody comes alone, a 21-year-old adult is really a kid. One should not, I believe, undertake surgeries on these patients unless they come with somebody more responsible. And lastly, but not in the least, I mean, it's a simple math. Let's say one doesn't know anything about liposuction. You are putting X amount of fluid into the body. And after the fluid goes into the body, then you are sucking the fat out of there. Obviously, what goes in and what goes out, there has to be a balance. I wrote a very interesting article several years ago. It's been published in the British Journal of Plastic and Reconstructive Surgery, called JPRAS, where I had suggested strategic, planning and risk quantification before you undergo liposuction. In this particular case, what probably happened was, inadvertently or intentionally, a lot of fluid was put in. Now, one of the best safety ways of making sure that these things don't happen is by make sure that you put fluid into the body in a sequential manner. For example, if you're doing the right side of the body, just put the fluid in the right side of the body to finish the liposuction on that side, and then go over to the other side. So if you just keep on putting fluid in, we have something called input and output. Input is the IV fluids going in. Input is the tumescent fluid that is used generally in liposuction. And what we are extracting out plus the urinary output. So you must add the two inputs, in this case, IV fluids going in and the tumescent fluid in for liposuction. You add these together, and the ratio should be 1 when you add the fat coming out and you add the urine that has come out. If this ratio is not maintained at 1, there is something in surgery called third spacing. It's a very simple thing. The extra fluid goes to the third space. In this case, it's your lung. So the cause of death in this case, if I was to guess two things, the first thing would be something called pulmonary edema, where there is a whiteout in the lung and there is no room for the patient to get any oxygen. The other possibility is something called PE, or pulmonary embolism, where a blood clot is formed somewhere, usually in the legs or a major vessel, and it goes into the lung and sits in the lung, obstructing the lung and not being able to breathe. This is typical. When a patient goes home, feels uneasy. When somebody tells you they're feeling uneasy, remember, it is a warning sign that they are in a state of hypoxemia, or in simple English, they are not able to get enough oxygen into their bloodstream. So unfortunately, if it's a PE, which I think it very well could be, which is a pulmonary embolism, the end comes very quickly. There's no time to really act, because there's a cascade of events that happens following the blockage in the lung, and so it is a point of no return, and that's probably what has happened. So going forward, what I think people should keep in mind that all surgeries are important. They come
Okay.
with a bag full of benefits, risks, and options. So you must know that. You must go to somebody with experience. I've been doing this for 20 years plus, and you must be humble. Every time I do a case, today I did a case, a young lady, mother of two, liposuction and tummy tuck. I pray to God, that I have the right decisions I make. Watch me, give my hands, and I'm not distracted doing 15 cases here and there. I do one case. You have to be you're attentive. You have to be attentive, and you have to be knowledgeable. Your grasp of medicine should be fantastic, because you're the first guy on the scene. There's the anesthesiologist too. So
Right.
in short, well-trained people, in good hospitals, major institutions, and you must follow the ratio of 1:1.
All right. Thank you so much, Dr. Thomas, for patiently explaining to us the risks and the measures that are involved in these kind of surgeries. Thank you so much for speaking to us.